Oh, I'm lucky. I know how lucky I am. And I'm so fortunate at this point for every little miracle that put me back together.
After surviving being struck by a car at 20, Mary Reeves has spent decades living with pain, braces, and instability in her knee. Now at 76 and waiting for knee replacement surgery, she says an exercise and education program called GLAD is helping her stay mobile, strong, and independent.
It's like brushing your teeth. You look after yourself. This is looking after yourself.
The GLAD program is designed to help people with hip and knee osteoarthritis. Mary says the program has not only strengthened her muscles, it changed her mindset about what she's still capable of doing.
The biggest thing to overcome is yes, you can do it. Go.
A vast majority of people that start to exercise get better. They feel better, they move better, they take less pain medication.
In this story, Mary shares why movement matters and why she hopes others living with osteoarthritis won't give up on themselves.
And the last little visit was you need to prepare yourself. At some point, you'll get a phone call for surgery. My sister, who had both her knees done, when I would visit with them, they were always exercising. And it just shows you that the more you put into it, into your stability and your muscles and your balance and your core, the happier and the more your recovery will be that much more advanced. You got to push yourself. So I thought, knowing what I know and seeing how well it worked for my sister, that I needed to get off the chair and put the tools together. Well, the first couple of days, they had an information session that explained arthritis, injuries, and the purpose of the program, and how what hopefully you'll expect. The doctor gave us a pre-test to see of our mobility and how much we were capable of doing some of the exercises. And so he timed it and he indicated that at the end of the program at your graduation, that they would redo these exercises in timing to see how much you've improved. And I mean, that's not important, but you really do feel good after you get a bit of a results that, I don't know if it's 6 weeks, I forget, timing, twice a week. I could feel myself improving. So when I had the test done to find out my crunches, how many more crunches I can do in a 2-minute timing, worked out really well. And it's a core exercise. Nothing was difficult because I think they're very well trained to be gentle. And I felt that way. And it's kind of like, you take the sweat off your forehead and don't worry about whether you're groaning, you're sweating or you're groaning about anything, because we're all feel the purpose of coming here is just to change our attitude, look a little differently about what we need to do for us. Changing the attitude is, I think, most for yourself, that you can do it. But don't be hard on yourself. Don't over expect. Stop when you have to stop. Don't be, don't feel disappointed because you're just doing something that you used to be able to be so free at doing in your younger years. And now it's kind of like, okay, how did I get here? Be happy with it. You're here. That's how I felt. I think when you become more isolated in your own mind, in your own head, that your knees or your hips and you're uncomfortable and you're not able to and you're not able to, and you notice you're losing it a little bit more and a little bit more, then that little bit more will end if you don't keep moving and keeping your muscles and your body in as strong as it can be. Strength is important. Well, I could have put the stop sign and said, oh, don't go, because, the biggest thing to overcome is, yes, you can do it. Go. Just go. Because the environment, at least with the doctor that we had instructed him, he just was so empathic of being able to understand. I know your body feels crumbling, but it's not. You can still do it, and I'm here. And he's just good feedback. That was great. That's great. He's giving you good feedback, and that opens up that message part in your brain that you start to say, well, I'm sure he's telling me, but I know I need to know it, but I need to believe it in myself. Well, we're in the room, there's 7, 8 people, and there was various times that somebody was new starting in, and that their fear, I think, that they'll hurt themselves because they feel pain, and that they're awkward, and something, is just going to change it, not in a good way, but they're going to feel, more pain. Well, I think you feel tightness and pain, but it's not more. And if it is more, stop. And you may feel a little different the next day, but that's just saying that's the gift that you get for doing something, that you're pushing yourself outside that bubble. So, yes. And so this, you look around and you see somebody new starting, and they're kind of fearful of their balance and awkward and clumsy and so on. You can feel for them. But in a couple of days, it's just that reassurance that they start to see, I'm quite able to do it. Well, I'm sitting here waiting.
Oh, you haven't had it yet?
No. And I'm also saying, if I keep up these exercises, I can still run up and down the steps. Running, well, in my language, I can fly up. And it's good for your heart. It's like, do I really want that much pain? Because it is. And can I live my quality of life up to the end by just doing some of these exercises and not have to go through the surgery? And numerous people that take the course that I've talked to, that's why they're there, to hold on to what they have without proceeding through to have surgery. It doesn't wobble. And I think I can associate that with my muscles are stronger because of the construction of the injury. My leg moves from side to side and it gets shaky. Now I haven't experienced it. So that's the big difference. It's much steadier.
And you did that.
The accomplishment is you're not lazy, you're doing it. You're youthful. And just get it into your mind. It's like brushing your teeth. You look after yourself. This is looking after yourself. It is a habit, and I don't expect it. The only one that's going to take it away from yourself is you. And that's just silliness.
But our program, the GLAD hip and knee program, is the green, the education, exercise, and weight control. Lots of people that come through the GLAD program, they go through that step and they feel significantly better. Some do not. Those that do not, they go to the second line of treatment. And second line of treatment is the one in orange, and it says pharmacological pain relief and passive treatments given by therapists. So I'm a chiropractor. I see lots of people in that orange zone where people come and see me for treatment so that they can feel better, or they'll see a physiotherapist in my office, or they will ask me to send them for some kind of an injection to help them with their pain or discomfort. And certainly I can facilitate and organize that. Those people that go through this orange step and they still are struggling, they're still in pain, then they are a good candidate for surgery. And those that are true candidates for surgery, they generally experience a significant pain relief. Now, to give you a little statistic, people that have osteoarthritis of the hips and knees, about 10% of them will end up having a total joint replacement. So 90% will not, and then 10% will. And then everybody should kind of look at this and go through this treatment pyramid so that they know where they're at. Again, our GLAD hip and knee program is based on education, exercise, and weight control. It's a 7-week program, and people go through education first week, and then we show them low impact activity and exercises so that they can move better and feel better. And this is that same osteoarthritis treatment pyramid. Now, I had somebody in my class yesterday asked me about can the GLAD class and specifically hip and knee class, can it prevent going into a surgery? And I said, yeah. And here's why. People that have osteoarthritis, they may have pain, discomfort, stiffness. They don't have confidence in their joint, whatever. But when they start exercising, they feel better, they move better, they take less pain medication, they sleep better, etc. If that's the case, and if they have very little pain, in most cases, they would not be a candidate for surgeries. Those people that have persistent pain, they can't get that pain under control, whether with oral pain medication, whether with treatments, then they are more likely to go through it. However, the imaging remains the same. And remember how I said how we diagnosed osteoarthritis. So osteoarthritis is irreversible, but the amount of osteoarthritis somebody has does not really dictate or equal how much pain and disability somebody has. So if you have severe knee or hip arthritis, but you have very little pain and you can move around and do stuff perfect, then likely you won't need surgery or have it. Those that have pain, but they go through the program or they start exercising and they start feeling better, they're likely not candidate for surgery. But those that try everything under the sun and they still have a huge issue with pain, discomfort, and their quality of life, and then they are more likely to benefit from a surgery. So here's one of the slides where I think this GLAD program is publicly funded. Now, not to everybody, but it is publicly funded. So they did a study looking at pain and function people with osteoarthritis and what modality and treatment works the best. So the first one is education, and GLAD is education and exercise. The second one is weight loss. The third one is exercise. Paracetamol is Tylenol, and NSAIDs is non-steroidal anti-inflammatories such as Advil. So if you look at the slide, exercise by far is best for pain and function of osteoarthritis. And I think this is the slide why the powers that be said, okay, we will fund this program because it seems to help. So exercise really, and when you put education with exercise, then it would be even better. So neuromuscular exercise can help kind of strengthen the hips and knees, and it can help resume cardiovascular activity, whether it's endurance or physical activity in general. So neuromuscular activity will give people a bit more oomph so that they can do stuff with a little bit less pain. So when it comes to research and neuromuscular activity, there was a 28% reduction in pain when employed neuromuscular activity, and there's 35% increase in physical activity that people have employed neuromuscular activity. And remember, this program that we teach at our clinic, the GLAD program, it is individualized program, and everybody has different degrees of arthritis and different abilities. So we try to individualize that for every single person so that they can do some of these things. I flew through this content, but what I want to leave some time is for any questions because I always get a lot of questions and I find that through questions I can do a better job of answering. Now, just to give you a little bit of about the GLAD itself, we have the program at the clinic that runs every 4 weeks, and there's an education component and exercise component to it. It is 7 weeks. First week is the education, and everybody that wants to go through the GLAD pack, they have to go through the education first before they actually do exercises. And our exercises are twice a week for 6 weeks. So there's 12 exercise sessions and 2 education sessions. If anybody has any questions or they want to reach out to me directly, there's 2 ways you can get in contact with me. My email is right there, so you can email me. But if you call my clinic, Momentum Health National Spine, at that number there, my front desk staff can organize a phone call between the two of us, and then it's completely free. And then we can just, chat one on one to see what it is that you need, and kind of go from there. Thanks,
My
everyone.
first question would be, do you need a doctor's referral to get this?
Okay, so if you have a doctor's referral, the class would be covered by publicly funded. However, not every doctor has the ability to refer. And the reason for that is the funding is only available to two primary care networks in Calgary. One is West Central Primary Care Network, and the other one is South Calgary Network. Now, if your family doctor is in one of those two networks, then they can refer into the program. If they are not, then you need a referral to get into this program. If you wanted to pay for the program costs, I believe the hip and knee cost $480 or something like that. But
490 total cost, $35 per session.
Okay, so $35 per session, and there's 14 sessions. Now, another thing is I am a chiropractor, and when people come in and pay for this class, it's as if they are seeing a chiropractor, so they can use their benefits. People that are over the age of 65, everybody in Alberta has this called Seniors Blue Cross program, and that program renews every July, and there's $200 worth of chiro in that program. So people that come in on that program, of the $35 a class, they pay $10, and $25 of that is covered through the Alberta Blue Cross.
But if your doctor is within West Central and South PCNs, it's definitely covered,
Correct.
all of it. And you said the workaround is to get a referral, go through a chiropractor's office to get it on board with to get on board with GLAD.
Sort of. So sometimes some people will come and see me, and then I can refer them to a doctor who then can refer them to the GLAD program. Yes, and a lot of times when people go and see a surgeon, the surgeon will say, "Have you gone to the GLAD class yet?"
Mm.
So that it's a really well-known program, and I tell people it's kind of like a first aid and CPR. It is a standardized program across the world that's being taught in other countries, and we teach it here in Canada as well. But it was adapted from Denmark, and surgeons are on board. And sometimes we'll see people that need a hip or knee replacement go through the program. Sometimes we'll see people that have had hip and knee replaced and then go through our program. And sometimes we'll see people that have a little bit of arthritis, but they're just going through the program just so that it doesn't get any worse.
And this is more of a subjective thing, but how much pain should a person, I guess, be expected to push through if they do have the osteoarthritis and some things may cause some pain, some exercise may cause some pain. Are you expected to push through a certain amount of pain?
That is an excellent question. Now, what we teach in the GLAD class, and this is the GLAD material, is we use a pain scale 0 to 10. And we want to be around 5 or so. So people that are in the very low numbers, so let's say 1, 2, 3 out of 10, they're not really challenging or pushing their body. But people that are in the 6, 7, 8 plus, they run the risk of aggravating their condition, and then all of a sudden they're in pain. But how it works is if somebody is doing an exercise, they want to watch this pain scale, 5 or less, or around 5 or so, but they also want to see how they are 24 hours after. Because sometimes people go through the exercise and go, hey, that was a piece of cake. I feel no pain. And then 24 hours after, they're in severe pain. And that means they've overdone it a little bit. And then those that have zero pain at 24 hours, hey, maybe you could have pushed it a little bit more.
That's an excellent guideline. So that 24-hour rule, if you're hurting much more after that, then ease off the gas pedal.
Correct. Correct. And that is
Okay.
a official glad hip and knee material.
Okay. And are certain exercises better than others for someone who, say, has it in their knees?
So, also a good question. So, when we have people go through these exercises, they'll say, hey, I can't do this because it hurts. And we go, okay, no problem. Let's modify it. And then we modify it. But 2 weeks after, they go back to that old exercise, and all of a sudden that doesn't hurt. So basically, what we're trying to do is we're trying to teach people to go through the movement, to explore the movement, to get as much strength and endurance as they can, but modify it because we're really sensitive to the pain scale. But oftentimes, an exercise A can hurt, but in a few weeks' time, that exercise no longer hurts.
Just a matter of getting the body used to it.
Correct. So if you find the activity that you like to do, go ahead and do it. Now, if running is one of them, and you're looking at this 0 to 10 pain scale, and you're able to run, do it, regardless of what your x-ray looks like. But if you're not a runner, and all of a sudden you're like, oh, wake up one day and say, I'm going to run 10K, it's a bad idea.
How about that actual the idea of putting your body weight against something? How important is that?
It's excellent. That is a weight bearing activity, especially running, and is really good for bone mineral density. Sometimes people they'll say, "Oh, I only swim or I only do aqua size." That's great, but you're not really helping your bone mineral density. So that actual load into the joint, even though that joint is osteoarthritic, is actually really really good. It doesn't have to be squats. It can be some stretches. It can be, going up and down to stair or whatever. But the GLAD exercises, they are not groundbreaking exercises. They are exercises we've all seen before, but they are done consistently and they are done supervised, and it is individualized for every single person in that class.
How big are the classes
We
generally?
max them at 8. So generally there's 4, 6, 8 people in there, and it's good. I like the classes because in my own practice, I wish I could introduce one patient to another because they have the same thing, but due to privacy and confidentiality, I can't. But in the GLAD classes, they actually get together and see, and they find out that they live close to one another, and they'll go for coffee after the fact. So I have had one person that would come to our GLAD class and couldn't do much exercise, but she felt much better after she finished, and she made a few new friends.
What a great side benefit that is.
Yeah.
A great social outing as well.